Hi, my name's Corey Schneider. I'm a goalie for the New Jersey Devils. I've been involved with the ARP for almost 5 years now. Started back when I was playing in Vancouver, and I found it very useful to keep me on the ice, keep my legs fresh after a tough game or on the road. And also anytime I've had to sit out for a couple days or have a minor injury or something, it's always helped me get back on the ice a little bit sooner than I thought I would. So, it's a useful device, and we've been using it for quite a bit in the hockey world. So, big supporter of it.
Hello, my name is Scott Duggan, and I'm the Director of Strength and Conditioning at Athletic Evolution in Woburn, Mass. I'm here in our ARP treatment room, and I want to talk to you today about the benefits of the ARP Rx100. The ARP is a one-of-a-kind machine that allows us to treat the injury neurologically at its origin rather than physically where the symptoms end up. To understand the ARP, you must first understand the human body. Your nervous system is like the wiring within a computer. Faulty wiring or a short circuit can cause problems to show up elsewhere in the computer, such as the screen you see. If you replace the screen, the computer might work for a while, but because you didn't fix the origin of the problem, eventually down the line the screen will break down again. Your body is the same way. If your nervous system is not firing correctly, an injury will show up in the muscles, tendons, and ligaments, but it did not originate there. Physical therapists and strength coaches can address the symptoms and where the pain ended up, but if the origin of the pain is never addressed, the injury will never fully recover and/or will return. The ARP allows us to treat the neurological disconnect, the origin of the pain, so the pain and injury are alleviated, but more importantly, don't ever return again. Neurological disconnects occur when the body adapts to an injury by walling off inflammation with scar tissue. The scar tissue causes a disconnect between the nervous system and the muscles. If this relationship is not repaired and the neurological disconnect remains, compensation patterns will occur and lead to further pain and injury. When you come in for a free trial session on the ARP, we are going to first find the neurological disconnect by what we call a search. Once we find the neurological disconnect, we are going to break down the scar tissue and rebuild the neuromuscular relationship through prescribed movements. These movements will help us break down any compensation patterns you may have, strengthen your muscles, increase range of motion, and rebuild your neuromuscular relationship. The ARP is so effective at doing this because it allows the patient to do the movements at a slow rate to emphasize perfect technique, while simultaneously sending a signal to your brain 250 times faster than you would without the machine. This leads to muscle memory taking place significantly faster and compensation patterns being eliminated at a rate faster than any physical therapist or strength coach could accomplish with traditional methods or modalities. This process not only leaves you feeling pain-free, but also makes sure the pain and injury never returns by locating, treating, and correcting the origin of your pain. Benefits of the ARP include increasing blood flow to the affected area post-surgery and for recovery, finding and correcting the neurological disconnects, rebuilding the neuromuscular relationship, eliminating compensation patterns that led to previous injury and/or can lead to future injuries, increased range of motion, decreased pain, and strengthening important muscle groups associated with the injured area. Whether you are an athlete trying to get back on the field faster after an injury, or you are an adult who is limited at work or in your everyday life due to chronic pain, the ARP is the solution to alleviating your pain and correcting your ailment.
I'm Martin Hippolyte, University of Connecticut running back, fullback, NFL free agent. I strained my hip flexor severely, and I wasn't able to run for my NFL Pro Day when I was training. After using the ARP, I squeezed in 10 sessions in a matter of 3 days, and I've been running pain-free ever since.
Hi, I'm Luke Jones. I'm 29 years old. I've had a landscape business for 8 years. One day I woke up and had no movement in my neck, severe pain. Couldn't touch my chin to my chest. I had no rotation whatsoever. After one session with the ARP, the pain was going away. After 3 sessions, whatnot, I could touch my chin all the way to my chest, which I never had been able to do. I tried, physical therapy, chiropractic, massage. Nothing worked, and just really recommend the ARP machine. It worked out really well for me.
My name is Nick Triano. I'm a college lacrosse goalie. After chronic back pain for 2 years and various visits to numerous doctors, I was told that I would never be able to play lacrosse again. After 6 days on using the ARP machine, I was able to come back to practice at 100%. 3 days later, I played in my first game at 100%.
We hope this video helped you learn and understand more about what the ARP can do for you. There's a reason that over 2,000 professional athletes currently trust their careers to the ARP Rx100. Whether you suffer from chronic back pain, are coming back from ACL surgery, or suffer from chronic tendonitis, the ARP can get you where you need to be faster than any other modality out there today. We want you to feel the difference the ARP can make. To set up your free complimentary session, please contact the main office at 781-935-7701.